Hello, my name is Samantha Mohammed. We will be discussing dyshidrotic eczema. We are Group 4. Our members are myself, Samantha Mohammed, Rihanna Noel Bolai, Cheyenne Rama, Shireen Mohammed Nabi, and Randy Maiku. We will be discussing the causes, the symptoms, the pharmacological treatments, surgical treatments, and other alternative treatments. Welcome everyone to our discussion today on dyshidrotic eczema. Are we all ready to start?
As ready as can be.
Yes, excited.
Oh, yes, I am happy to be here.
Of course, I did a lot of research.
Okay, great. So what is dyshidrotic eczema? Dyshidrotic eczema is a type of skin inflammation. It causes a burning, itching feeling and a blistering rash. It can affect your palms, the sides of your fingers, and the soles of your feet. In some people, symptoms can be quite severe. Causes of dyshidrotic eczema.
The term dyshidrosis was first used in 1873 to describe the incidence of the blisterings of the palms and toes. It affects teenagers and adults, but mostly adults in their 20s to 40s, and is twice as common in women as in men. The direct cause of dyshidrotic eczema has not yet been determined, but there are some known risk factors that contribute to this disease, such as atopic dermatitis, exposure to contact allergens or irritants, hyperhidrosis, smoking, exposure to ultraviolet light, and intravenous hemoglobin use. Things that can set this off can include stress, contact with metals like nickel, cobalt, or chromium salts, custom jewelry, sweaty or wet hands and feet, warm, humid weather, HIV infections, hemoglobin, and seasonal allergies. About half of patients with dyshidrosis eczema acquire other types of eczema, such as contact or atopic dermatitis. This disease is not contagious, therefore, you can't obtain it from skin-to-skin contact with someone who already has it.
Thank you, Cheyenne. Now we will have the symptoms of dyshidrotic eczema.
Symptoms of dyshidrotic eczema. Dyshidrotic eczema shows symptoms that frequently lingers on. These symptoms may last for several weeks at a time. The most common symptom of dyshidrotic eczema are small firm blisters on the sides of your palms, fingers, and sole, extremely painful blisters, itchy and scaly skin around the blisters, increased sweat around the blisters, and dry, cracked skin that appears as the blisters fade. Dryness, peeling, redness, or fissures may appear in some persons. A pruritic vesicular eruption that may appear on the fingers, palms, or soles characterizes this kind of eczema. These symptoms necessitate a medical diagnosis. The skin on your fingers, hands, and feet may thicken if you scratch them frequently. Itching is typical, which may result in infection or large blisters, or large areas of blisters may become an added problem if blisters are not treated properly. This illness, which can be acute, recurrent, or chronic, also affects adults and teenagers. Even though there is no cure for this disease, it is manageable in most cases.
Thank you, Shireen. Now we will have the pharmacological treatment. Dyshidrotic eczema, also known as pemphigus or dyshidrosis, is a skin condition characterized by small, itchy blisters that typically develop on the hands and feet. The primary goal of pharmacological treatment for dyshidrotic eczema are to reduce inflammation, relieve itching, and promote healing. Here are some commonly used medications. Number 1. Topical corticosteroids. These medications help reduce inflammation and relieve itching. They are available in various strengths, and your doctor will prescribe the appropriate one based on the severity of your symptoms. Number 2. Topical calcineurin inhibitors. These medications, such as tacrolimus and pimecrolimus, work by suppressing the immune response in the skin, thereby reducing inflammation and itching. They are particularly useful when corticosteroids are not well tolerated or are ineffective. Topical or oral antihistamines. Number 3. Antihistamines can help alleviate itching associated with dyshidrotic eczema. They are available in topical creams or ointments, as well as oral forms. Common antihistamines include diphenhydramine, loratadine, and cetirizine. Number 4. Topical or oral antibiotics. If your eczema becomes infected, your doctor may prescribe topical or oral antibiotics to treat the infection and prevent further complications. Number 5. Moisturizers. Regular application of moisturizers helps to keep the skin hydrated and reduce dryness, which can alleviate symptoms. Look for moisturizers that are fragrance-free and hypoallergenic. Number 6. Soaks and compresses. Soaking the affected area in cool water or applying wet compresses can provide relief from itching and help dry out the blisters. Your doctor may recommend adding ingredients like potassium permanganate or aluminum acetate to the water for additional benefits. It is important to note that the specific treatment approach may vary depending on the severity of the condition and individual patient factors. Always consult a healthcare professional or dermatologist for an accurate diagnosis and personalized treatment plan for dyshidrotic eczema. Thank you. Now we will have Rihanna with the surgical treatments.
Surgical methods used for treating dyshidrotic eczema. There are not many surgical procedures that are used to treat dyshidrotic eczema, but if all alternative measures fail to work, these are some methods used. In some cases, blisters do appear on the sole of feet and palm of hands. If the blisters are very large, a dermatologist may suggest draining the fluid from the blister to help relieve the pain and swelling. People with chronic severe symptoms that aren't responding to other treatment may benefit from a type of phototherapy or light therapy. This treatment uses Zorlin and ultraviolet light. Zorlin drugs may make the skin more receptive to the healing effects of the ultraviolet light. Ultraviolet radiation used in phototherapy has the potential to improve the symptoms of inflammatory skin conditions by decreasing the production of cytokines, proteins produced by certain cells of the body that can cause many autoimmune conditions. There are several forms of phototherapy used to treat dyshidrotic eczema based on the light wavelength used. The length of the light wavelength determines how deeply the light is able to penetrate into the layers of skin. Ultraviolet radiation used for this treatment is typically in the UVB ultraviolet B range of 200 to 320 nanometers in wavelength, to the UVA or ultraviolet A range of 320 to 400 nanometers in wavelength.
Ultra B radiation can be further divided into two different types. Narrowband UVB, which ranges from 311 to 330 nanometers in wavelength, which causes much less redness than broadband UVB and is more effective in decreasing the symptoms of the eczema and may lead to rapid remission of the symptoms. UVA penetrates deeper, which may be effective for thicker plaques or raised inflamed scaly patches of the skin, while UVB penetrates more closely to the skin surface. Usually, this treatment is usually used often in severe cases, and it is performed in a dermatologist's office or a hospital, and may be required for maybe a few weeks. That's all. Thank you.
Thank you, Rihanna. Now we will have Randy, who will bring us the alternative medical treatment.
Hello everyone, my name is Randy Maiku. I will be doing the alternative medical treatment for Dyshidrotic Eczema. Firstly, a medical professional will recommend that the patient that is diagnosed with this type of eczema have a change in their diet. This is because when the patient consumes any products that has cobalt or nickel, they tend to have a flare. This is because these metals are hypersensitive towards the person's immune system. The foods that the patient should avoid will include fish, nuts, and green vegetables. The alternative medical treatment as a result will be a diet that does not contain these metals. The patient therefore will have to be in a low cobalt and nickel diet. Secondly, the medical professional will recommend that the patient manage their stress levels. This is because stress levels causes the immune system to use a stress hormone called cortisol to force the immune system to secrete inflammation within the body. This, as a result, causes the skin to become dry and itchy, resulting in a flare-up. Since the patient has to avoid anti-inflammatory foods because they are rich in cobalt and nickel, it will be recommended that the patient seeks a therapist and join behavioral therapy or any form of therapy that can help manage their stress, or seek spiritual guidance such as meditation and yoga, which can help relax their mind and avoid a trigger. Thirdly, traditional medication has always been used to treat this type of disease. These will include neem creams. These neem creams are used to reduce the dryness of the affected area and ease the itch, and coconut oil, which helps the skin to remain hydrated and could reduce inflammation. Lastly, the medical professional will also advise the patient to avoid products that contain nickel or cobalt. Some of these products may be rings or jewelry that contains nickel. Avoid cosmetic soaps or body wash that contains nickel, or avoid doing cleaning with bare hands. Instead, use gloves, because if the skin comes in contact with any of these metals, it can cause a hypersensitivity, which results in a flare. This concludes my presentation on the alternative medical treatment for Dyshidrotic Eczema.